Clinical audit is important because clinical audit is a good quality improvement tool. So I want to explain what I mean by clinical audit, because it means setting a standard. People think that stuff happens, but actually it often doesn't. So setting a standard, what you think is going on, and then going and exploring to see whether that actually is what happens. And if you identify a difference, which we often do, working out what needs to happen to reduce that difference, and then making that change and redoing the audit. And the problem is, lots of people who do audit identify the standard, investigate the gap, suggest a plan, and then move on to a new job. And that's only half of the job. For us to really improve quality, we've got to go all the way around the cycle.
My name's Joanna Parry, and I'm the principal nurse for the medicines management team, and I'm now based at West Heath Hospital. My top tips to a friend doing an audit would be to keep it simple, have a clear idea of what you want to audit, and have a simple audit tool in which to gain your information from. If I were to sum up clinical audit in one sentence, I would suggest that it is about maintaining or improving the standards of care that we deliver.
My name's Shwint Basra-Dillon. I'm the clinical lead and ops manager for Sandwell School Nurses as part of BCHC. The benefit has always been learning, and it always makes you review what your own practice is. And in terms for staff, whilst they've found it difficult because nobody likes to have their interventions looked at, it's made it it's brought it home that you do need to review your practice, and if there's learning to be had, then it needs to be in place. My top tip, get somebody else to do it for you. Apart from that, no, delegation, but also making sure that actually you're telling them the reasons why you're doing the audit, and you get participation on a voluntary basis rather than just saying, well, audit needs to be done and that's it.
So my name's Schwab. I'm a clinical specialist and neurophysiotherapist. I think clinical audit for me is all about trying to improve the quality of care that we are delivering to our patients. The audits allow us to understand where we are and where we would like to be.
So everyone can be involved in audit, and everyone probably should be involved in audit. Its background is in the medical profession. So when I was a very young doctor, there was quite a lot of resistance to it from the senior colleagues at the time, but in the late 1980s it was emerging as a tool within the medical disciplines. But it's a clinical tool. Everyone who's a clinician or otherwise can use audit as a way of improving services. So I think it should be part of standard nursing care, allied health professional care, as well as medical and dental care.